Hi, Lokesh garu.
Namaste, sir. Can you hear me? How are you? Good morning. Can you hear, sir?
Yeah.
Okay. Namaste, Dr. Sanjay Bedi. Namaste, sir. You're muted.
Yes. I think
Good evening,
it's
sir.
good morning for you, good evening for us.
Yes.
So you can just try sharing screen.
Thank you.
Just a
It
moment.
is
I'll make you the
co-host.
Yes. Yes. We can see.
Yes. Sir, I can see and I can hear.
Yes, perfect. So we still have 7-8 minutes.
Sure. I like to meet Dr. Jagan Kakarala, sir. He's in Ann Arbor. Sir,
Okay.
Dr. Sanjay Bedi is from Ludhiana, esteemed professor. Sir is Dr. Jagan Kakarala is the one who made in the Congress of United States make the discrimination. You cannot discriminate against a country of origin by medical doctor in India, America.
Okay.
That's done in 1993. That's why the USMLE exam is same for American graduates and Indian graduates, same.
Okay. Great.
And they followed. Yeah, that was it passed in Congress of United States. I think it's initiated at Bill Clinton and Ted Kennedy's help, and finally it is passed. I think George Bush signed, and they made a committee, COGI, and he was the chairman for that committee. And ECFMG president is a member. So Sir is the chairman, ECFMG member. So these are the things we already made global impact from India.
That's very good. And now, as we move forwards with the availability of these scenario-based questions and next examination, we will be, I mean, an assessment revolution is coming.
Yes, sir.
We'll just wait for another 2-3 minutes. People are joining.
Okay, sir.
Hello.
So friends, welcome to today's session, and today we have a very interesting person from America, from uh, Kalamazoo. I think you all are uh, aware of the Kalamazoo Protocol, which we all study for communication skills. And Dr. Lokesh Adara, he is an allergy and asthma and clinical immunology specialist in USA, and at WMU School of Medicine, Kalamazoo, Michigan, USA. He is a chairman of the API Global Medical Education, and from there he has moderated more than 50 COVID-19 webinars since March 2020. And his vision is that every medical student should graduate with equal knowledge and confidence as in USA medical graduates. And our Indian students should also do research equal to USA medical students, for which he has been working for quite some time. He has written to MCI chairman many times, and he wrote the white coat ceremony. And also he has been working with the emergency medicine department in a lot of medical colleges in India, making way for the emergency department ownership. And he is he's a graduate of from the Guntur, GMC Guntur in 1982. He is our own person who has settled in USA. So over to you, Dr. Lokesh. In case I have missed something, you can uh, introduce that, but
Thank you so much, sir. This is Dr. Lokesh. Thank you, sir, Dr. Sanjay Bedi, sir, for giving me this opportunity to present to the esteemed body from faculty across the India. I really, really appreciate. I'm going to share my screen.
yes, sir.
So I come to you, this presentation objective is about strengthening medical education, which you all working hard, and we'll try to see in globally what are the gaps. And my presenting this topic to you as a research assistant and analyst to you. And medical education make in India, we have a lot of strengths in our medical education. Our medical education faculty who are in India and went to the abroad are making big drives. I'll show you some example. And this is made for the world. Like we give a COVID vaccines to the world, like we give a cheap medication for AIDS across the world. So in Indian medical education will be in that way in the future. So there are strengths I like to present in a few minutes. Few of them, I'm sure so many strengths we have medical education in India. One of the unique is we have 22 departments in our forefathers and seniors founders established 21 departments. And there are a couple of gaps which are present. We are presenting to NMC about family medicine, emergency medicine. And this other great thing is basic course of biomedical research to all postgraduates and faculty. And we request this course, this excellent strength of Indian medical system, and we request this to MBBS student also. And also we're making, the other one is, one of the strength is mandatory publication of our PG and faculty. That's excellent strength for us. And we are taking initiative from that. We started our own journal in our medical college. One of them, first I joined Rangai Medical College before I went to Guntur. And our goal is at least 100 medical college should have their own journal. Another thing we came up with, maybe you all agree or not, I would like to submit to you, a medical student should be put on every publication. So that way they have a ownership of it. That way we can train future generations. So what is the benefits of department? See, mainly I see as a postgraduate seats is the strengthening of our health. Medical education is for mainly for to take care of public health, to save our family health. So that means mostly postgraduates are the ones who does the main work. And I'm going to present what is the strength of it. You have pathology, forensic, and microbiology together. In America, only pathology does the all of their work. It is 613. India has almost 4 times higher PG seats. But with the new medical college coming, will be more. So we have strengthening forensic and microbiology. I think Indian model is better because we serve better, more detail than the pathologist alone doing all other work. That's my opinion. So if you look at some of the specialties, anything 4 times or higher, Indian population is 4 times higher. Anything 4 times higher, we're already ahead, like radiation oncology, we're here ophthalmology, orthopedics are higher, even ENT. But some of the surgical branches, dermatology and radiology dermatology is almost 3 times. I think we'll can reach other line. But the gap here is we still need out of 117,000, we need 50 more thousand. So we presented the information to Niti Aayog and NMC. We need a family medicine PG seats, at least 20,000. In Australia, 44% of PGs are family medicine. So we present the data to the higher authority. And general medicine also will behind. And some of these branches are less. So these are the strength of our system. There's the gaps we are trying to present to the NMC and Health Ministry and Niti Aayog. I like to take a minute on some history. I like to present history. This Dr. Rodman, William Louis Rodman, he was in, it, he came to from Kentucky to Philadelphia, and he's a professor. Then they asked him to take an examination to get a license. So he didn't like it. So then he went for a nationalized exam. It took him 20 years. He is actually IAMA president in 1915. It took him 20 years to form National NBME, which is 110 years old. Still, they are the ones who are owners of USMLE. They are the only one body does continuous research. And unfortunately passed away a year just before his exam, the first exam. But it took them 1915 to 1940, all the states in the United States, except 3, joined them into them. Then again, 1950, that's where multiple choice questions started. The research showed that, and a dozen states went away. They said MCQ question is not good. So, but eventually they all joined into the 93 because they know the research and everything. So this, I just want to present this information and this is not happening overnight. So India actually is much easier. MCA and health ministry, if we can able to sensitize with academic help, we can able to do the right decisions sooner. And this is the original examination, 1915. As you said, you have all these subjects: anatomy, physiology, pathology, pharmacology, and oral examinations and laboratory. And this is still we're kind of following the theory in India. So essay versus multiple choice questions and protecting the public health. Their mission, essay, is just not the exam, it's the protecting the public health. So multiple choice format is 1956, as I mentioned, and I think we mentioned this 49 states accepted then. We in India, PG NEET, even before the PG NEET, all the states are conducting entrance examination. And next examination, which is standard, which is the NMC proposed. I think it will happen eventually. One of the main block I want to bring it to your attention, in 2019, MCQs, only 20% MCQ'd in our theory. Even if it is permitted, you don't have an option. I mean, you can give 20% MCQ in theory exam, or you don't have to give MCQ. That's the current status. And we presented NMC, they're looking into their academic committees. And high ordered concept-based clinical oriented questions. And now, not only USMLE, MCQs are UKMLE. In 2024 FLAB exam, they changed to UKMLE, so both national and foreign will be taking the same examination. So I'm going to present this from NMC. This is where one of the major block MCQs, if used, so you don't have to use, should not have more than 20% weightage. This is the major roadblock. That's what we're trying to present to the leadership. I'm going to share what some of the pictures. Dr. Abhijit sir, NMB president visiting USA. I requested sir whether he has time to see NBME of USA, and he obliged. And with the help of Dr. President of FSNB, we took and his president, Dr. Peter Kostakos, we went to NDME office, and which is established more than 115 years ago. They have exchanged their work, their research and work information, and it's just a collaboration, know each other. And now, then last year, sir came, Abhijit sir came for RP meeting, met ECFMG President Dr. Eric Homey, and we have a lunch meeting, and he asked for a few things. This is so what's going on in USA is I wanted to mention looking for alternative pathways for licensing, so that 30% of doctors in USA are 60 years older. I am one of them. I'm 64, and within 10 years we are all going to retire. Then the physician shortage will be a major issue. So why don't they produce more doctors? It's not that easy. Remember, USA, all the PGs get stipend from US government. How much? It's astronomical, $12 billion, equal to 1 lakh crores, which is almost like approximately our Indian Health Ministry budget in central government budget per year. So this is what PG students, so they're looking for alternative path, so that way they can go directly without it. So what they're looking is the postgraduates and IMG, like for example, pathology or maybe general medicine, pediatrics. Person pass the step 1, step 3 exam in few years of experience, and then give a limited license eligibility, work under a pediatrician or pathologist in America before they go to permanent. These are the models they are looking. So this is what we get by interacting with the leadership, knowing what's happening in USA. And I also mentioned, thank you so much for so many of your faculty as a FAMER fellows, which is, and I have presented the same information to current executive director recently took over, Dr. Loba, and she arranged another meeting with Rashmi Vyas, which you all know, and she's a senior director also in FAMER. And I presented the information about our challenges and see whether they can able to do research and publications. So they are visiting NBME National Board and Federation of State Medical Board of all America. Their leadership came to India, and then this is with the Gangadhar sir at AIMS with the leadership, and they're visiting in NMC and also National Medical Board they visited. So mainly assessment of USA, India, UG and PGs, that I'm going to mention what's happening in USA compared to us in here. So first I'm going to present a case about one multiple choice questions, the way they are looking like a Miller pyramid. So first they're giving a question. The 27-year-old female came to the office and asking, my friend have a baby which is neural tube defect, and I want to decrease her risk. So what should we do? So what kind of vitamins we need to supplement? And the biochemistry and faculty, of course, we tell about curve cycle and all metabolism, but what they are asking is, I'm going to go ahead and forward. They want to say the clinical aspect, myelocele. This is the patient, this is the baby. So why this? What happened? What we can prevent as in the Miller pyramid? So going back to the, and we wanted folate to be given. Obviously, folate is a biosynthesis of nucleotides, which are building blocks. That's what the question about ESMLA. This question is taken from ESMLA open there in their website. So this is what they're asking for. Every case we present, you have to give a present and going back to why we are reading it from the start, from the day 1 of the medical school. I want to mention we not only the U world is a product where I'm sure a lot of people know, and even Harvard students follow. Everybody who take ESMLE, that's again product of our own of Indian faculty. The Dr. Chandrasekhar Pemasani, he was in Osmania Medical College in the early 90s, and he came in present, and he initially made a book, but they didn't took it. Then with his brother, they started the web form, and then they went and so every student, and actually the way of teaching is changed. They're not teaching PowerPoint. The change is they do the question, read the question, then go and read the articles and videos and going from them. That's what the Harvard doing, self-learning, active learning. And now he's actually he's the Ministry of Rural Development in central government under Modi ji. He's from Andhra Pradesh, Guntur district, where my hometown. So how do the USA assessment during medical schools happens? So as soon as the student joins, every first week they give a gap. Second week honors, they will have a quiz every week, 20 multiple choice questions, 20 quiz in subject. So imagine first MBBS, anatomy, physiology, biochemistry, 20 quizzes, almost 60 quizzes. Currently, our internals are 3 internals. First 3 months, students take it easy, and while university theory examination. So there's other nationalized NBME, I show you, nationalized subject exam. So they give a flexibility to medical college. They have their own university exam, or they can take this National Medical Board 125 MCQ biochemistry or whichever the subject. So the first 2 years, during the first 2 years of medical school, typically in USA, they read 10,000 concept-based questions in step 1 in 24 months. That's why 90% students in 24 months pass the ESML exam. But our platform is not like this. Our students are smart, our faculty is smart. The system is different. That's what I want to present to your submission. I'm going to share, this is from a national medical boards, which I showed earlier. And they have 6 subjects like we have: physiology, pharmacology, pathology, histology, gross anatomy, and behavioral sciences. And they have 100 items. They call questions are item 125 to 150. So the exam is 3 hours 8. So these medical colleges, some of them take the NBME, some of them won't. Those who take the NBME, they get better scores in step 1. And also I wanted to bring it to your attention. In America, there is no practical exam, no viva, no ASCIIs. For MBBS students or even postgraduate, I'm an allergy super specialty, even cardiology super specialty, pediatric super specialty. They did enough research. Essay questions are very, very good, but implementation, and they mastered such a way they can able to get all the concepts. So they're able to do that. No practicals, viva, no ASCIIs, but everything is mostly MCQ based and concept oriented. And item writing is a big issue. That's where the chat GPT come, I was going to mention. So USA National Medical Board's clinical exams, again, we have surgery, psychiatry, pediatric, OBGYN, and family medicine, and other couple of things are there, different ambulatory and emergency medicine. So how is the difference? USA, they have 12 MCQs. Like India, we have essay questions, 2 of them, 6 short questions, 10 MCQs. But look at the items. NEET PG is only 200 we have 200 MCQs, but we don't have MCQ testing in the whole 4 years of preparation. We're not preparing them. MCQs in 12 subjects, if you total 1,447 questions. In USMLE, you can see total step 1, step 2, step 3. Before licensing, they have to take 1,000 questions. So before we license, everybody get be licensed in India before you go to PG with this with exams only. But this is what they went go so much of depth of the assessment they go through. And it's not the exams. Eventually, this student will take care of your family, my family. That's what the solution. So this is how they take the exam. When I spoke to President CEO of the NBME, I asked Lokesh. He told me, we do the criterion based assessment. I don't know the criterion based before. I went and read about it. So I said, what is it? What kind of example I can do? They measure against a set predetermined criteria. For example, in India, a military recruitee physical exam, it is a criterion based. 7 minutes they need to run 1.6 kilometers. So they need to prepare them. Of course, if I am running only 1 kilometer, I keep practice until I get 1.6, then I'm recruited. For women, it's in India, it's 9 minutes. That's why the practice is the question where we are, because of the platform, we're a little bit behind. So pass rate is same, MBBS pass rate, ESMLE pass rate, board exams pass rate, same, but whereas the DNB, which is a little bit less in India. There's other incentive in India. America is 90% of students have loan, $250,000. So that means they have to read. In India, we have parents, we have a government subsidy. But after postgraduate, our students are much, much smarter. The postgraduate is the key here because our clinical exposure is tremendous in India. And the pass rate, this I mentioned here, 96% student pass with Indian students can also do that with the appropriate training. So again, no practical exam, no. In a postgraduate also, like for example, pathology or medicine, first year they take they call it formative examination. All specialty have it. It's been going on since 1960s. Every postgraduate, if I'm a first year student, I take the exam 150 questions. I'm a second year, same exam. I'm third year, I'm same exam. First year I may get low score. By third year I get high score. By eventually the final year exam, again the criterion based exam, 90% pass. This is theoretical part. Again, remember, medicines, pediatrics, subspecialty do not have practical and viva. And we submitted same information for our National Medical Board in India, and they're looking at it, and so implementation. So implementation take time because the big country, big system take few years is even the shortest time. And there's one thing about NMC make a rule that we have to attend. That's what we need in India. But here they give an option of whether you can come to the class or you can listen, watch at home. And they did a study, no significant difference in knowledge acquisition between those two groups as long as active learning. So there are some classes they make it mandatory. India has attended physically all classes, and at the end, transfer of knowledge is the key. The other one I'm going to here, end of posting clinical assessment. Like for example, all clinicals, our students start second year. They end of clinic posting like OB/GYN, pediatrics, there is no exam at the end. We have 3 times a year internal, but not specific for rotation. And I'll show you a platform where your societies, like all your specialty societies, can help, or maybe NMC should bring an electronic platform to help. So there is a 1963 Association of Professors of Gynecology Obstetrics. 1963 they formed. Since 72 they had a product. It is usually before it's a book based, now it's web based. Bottom line is they have 600 questions, MCQs, and 50 videos, and they have 60 quizzes. Students take their own quizzes, but at the end of the rotation they take a proctored exam, and these results goes to the HOD. So I would request this platform can be created now with all the information. All the societies from anatomy to the medicine, they can create this web form and they can deliver very cheap. That's why we need to have a very, very efficient, lower cost with the NMC blessing with this extremely smart faculty. It can be delivered. Now it is in the private sector, but could be delivered more structured manner. And that's the only solution. We have 770 colleges. We have faculty is very low. And this kind of a platform helps as aid to the faculty, and this significantly reduce the strain for the faculty. What is the benefits of national-wide assessment? Because you don't need to create your own exam. It's easy, and you don't need to correct yourself, and results will be delivered. It's scalability. We can scalable to not only India, this can scalable to rest of the world, but especially low resource countries. Faculty support, this is great aid to the support, interactivity and accreditation and quality. Everybody can look at our quality. Competency based, I want to mention a word because you all know, you all practicing, it is in 2019 where NMC took the competency based, and but in 1978, WHO first white page report came 1978 by authors are Dr. Miller, Stokely, and Pearson, and Dr. George Miller and his pyramid. He is from 1919. In 1955, he worked as a coordinator, first medical education. It is not like one subject. He created a multidisciplinary research team. Then in the University of Michigan, he ORME, Office of Research Medical Education. He's the one who wrote the white paper in 1976 when I joined my medical school. So I did an experiment in, I requested and worked with madam in our Siddhartha Medical College in Andhra, and requested madam to, she already teaching, she does a lot of videos and everything, we really, and they requested to do only multiple choice questions, high-end, high quality discussion. And she did it and students liked it, because they're participating actively. We have to give actively. So I even thought about why not we chat GPT. I tried myself few questions in asthma, and the chat GPT give nice questions. So why not a student can create questions before? Why not a student can read the videos and then come back and discuss? So that's what our feature. I think we're going to lead India. We're going to lead world in this chat GPT. I'm going to mention a few more slides before. And there is a publication, ChatGPT don't trust 100%, is only 70% accurate. But this will give us, India is behind in item writing of MCQ. ChatGPT put us 70% ahead. The only 30% we can change it. And this is not copyrighted. So ensure high quality outputs. Using ChatGPT generate MCQ directly in examination. Don't use it directly because you need to improve it. Your faculty need help. Students can start and then discuss in the class. And your society, like every specialty society, can create a question banks and put it there for all the India. And that's what it is. It doesn't take much. We have thousands of faculty in each subject across India. You have greatest gift, you have greatest talent. We need your kind help. And here post-session MCQ test can be carried out in Google Forms or other. Actually, the best thing is create a electronic format, web format from the NMC, and that way it all can be tested, everything. Can India do what USA are offering if NMC allows? Of course, India can do even better. NMC allows not only Google Sheet, but currently it allows, but they can create a web platform with very efficiently. It is not implemented across India. That's what we need, a web platform. In my Guntur Medical College anatomy professor, in our January 14th, 15th, she created questions, but she asked me, sir, they're all going vacation. I said, madam, you have a group with your student, please put in that group. So she did it. And within 30 minutes, she got the results and she shared with everybody. So we can create the same questions. We have technology, although some institutions are coordinating, but not present across. So we can do this. How to create MCQ, I just mentioned. Creation, students can ask ChatGPT or other AI platform. These are not copyrighted. And before the class, if they create their own in Bloom's taxonomy, creation is the level 4. Uh, um, and there is our PG Net question. There's a publication. ChatGPT correctly answer 120 out of 200. So remember, 80 questions are wrong, but that means this 120 positiveness, we can take it to how we can improve on it. And it's efficient, it's cheaper, it's almost free, and we can do much better with the help of ChatGPT and AI technology. And flipped classroom, I know a lot of people are using flipped classroom. What I need is every class that 1 hour, every class anatomy, all 50 to 100 class, every class physiology, 100 classes should be flipped classrooms, should be active learning. Should be active learning. That's what we need. And NMC permit flipped classes. We're talking about Bloom's taxonomy level 4 is flipped class, whereas this, which is high level comprehension, application, analysis, synthesis, and evaluation. This is what we can deliver to our students. Actually, students can deliver themselves with your blessing. Rather than asking questions, this is an NMC, clearly mentions the Bloom's taxonomy information here. And in the Bloom's taxonomy, remember, when you give a PPT, this is 90% of our colleges going on. PPTs, what I am doing is remembering is only level 1. But level 4 evaluation, we need to go to level 4. So this is where it is NMC blessing. I came to know about Bloom's taxonomy name from a 5th grade teacher, I think 8 years ago. Level 1 knowledge, if you do whatever the PPT, you are giving only passive learning. That's not good, because we're wasting time of the kids, my opinion. Flipped classroom, they have to watch the free videos. So many videos out there, both national and international. Each topic, you can go depth of it. You can help and guide them what resources, but they watch the videos, they come read, they make the creation, and then go to and this is what the level 4. And so this is what we recommend: pre-class question creation, pre-class video learning, active engagement by faculty, talking about 3rd level, 4th level discussion. That's what my request submission to you. Request for specialty societies, videos, resources, so that all the faculty across the country, you can recommend some video resources or MCQ question banks you can create, and picture videos. And one example, biochemistry can make 6 peer-reviewed lectures. In America, they do the peer-reviewed lecture videos. So a specialty society can peer-review your own lectures and then put in your website, and that way high quality. And we have published several several digital education articles, which my all publications are with medical students. There's a website which is platform, and there's 100% MCQ test. Our students in India took 600,000 people, medical students took a survey. They said they all want my MCQs. They all want MCQs, and we want faculty need to hear that information. It is published. Nationalized assessment is published. Workforce emergency medicine published with the students. BCR, we're in the process. Neonatology workforce in the process. So whatever I take change in, we're trying to do the publications. And these are two publications. The last slide I will represent Dr. Jagan Kakarala, our esteemed, he's here in the meeting. He's in now 1958, our first year batch. He worked with Ted Kennedy, Bill Clinton, and he is the COG committee chairman and they said you cannot discriminate like sex, age, or race. Physician in USA cannot discriminate by country of whether you came from India or other countries. You cannot discriminate country of your origin. Once you pass step one, step two, you should be equal to anybody. That exam is equal. Their results happened. Universal examination, USMLE, UKMLE in 224. I think next is coming soon. So there is a morality of it here, and we really thank Jagan Kakarala sir. And this is the COG report, and he is chaired by Jagan Kakarala. Even ECFMG president is a member of it. He's the chairman. Thank you so much. I really appreciate your kind time.
So thank you, sir. What we understand that you are uh, advocating the use of lot of scenario-based MCQs and as flipped classroom and continuous discussions on for Indian medical graduates, and in the process use lot of technology for the same purpose. So I think India is, I mean, in the West, this since many years, these competency-based medical education is also there, but their assessment method is with very focused and very highly validated and higher level scenario-based questions by which they use. And this you propose that we can use Chat GPT for the purpose and uh, maybe create discussions around it and involve our students. So thank you. So the house is it is open to questions by the audience. There are. I'll start with Dr. Swapnil, who has raised his hands. Dr. Swapnil is a professor in physiology at Vadodara Medical College. Swapnil, you can ask your question. There are some questions in the chat also.
Good evening, sir. Sir,
Namaste, sir.
I'm Swapnil. I teach physiology and I have been practicing active learning for the past 10, 12 years. And I also did a flipped classroom study on fostering higher order cognitive
Yes, sir.
skills using scenario based MCQs. And students did well. Uh, and I think more of these studies should be done. One of the problems I faced was that the students don't re were not following doing the videos beforehand, so that the ERAT, which if one conducts an ERAT and asks them to, then there is a problem with and so I have to make them watch small videos even in the class and then do the higher order learning. Second thing is that with MCQs, students are doing MCQs in NEET UG, in the NEET UG also. And when they come to us in the first year, they're not able to express themselves because they are adept at solving MCQs. But when I give them a critical reasoning question to answer, they are not able to express themselves. Like, say, why does vasoconstriction increase blood pressure? How does vessel radius affect blood? Very simple things. Even if I tell, they are not able to put down in words. So that is a problem which every teacher in India is facing actually. I submit to your that MCQ should be there and higher order, and we also have a challenge with designing higher order scenario based MCQs, sir.
Thank you, sir. Yeah, I think expression, especially compared to where I am living here for last 40 years, the kids here express more than in India. So, and also there is hierarchical system. They're worried about expressing themselves. So there is this cultural thing. I think slowly improving over next 20, 30, 10, 20 years. It will grow more and more. And as we faculty move on to as a facilitator, then a teacher, and they're just giving a PPT. I think this will grow as the new younger generation comes. It will slowly improve. Any cultural change takes another 5, 10 years. I think it will improve, sir. And thank you, sir. Actually, I did not tell anything here new that you are not doing, but it is happening here and there. But we want together doing all the nation a platform. That's what it is, sir. It is there in tools, but it's not going upper because of our inflexibility. So that's
So
what my
one just point I
mission.
want to add, sir, that when I started 10 years back, the critical thinking skills of my students were very limited. But now I think with the improvement of the school system and enhancement of the NEET UG also, students are much more able to think critically, able to apply the information also. Particularly because I'm in a very good college in Gujarat, like where the top students come. So students are have improved over the past decade considerably. That is what I feel.
Actually, sir, my goal is not the top college, even the lowest or the smallest or the poorest school. Last student is my goal. If you put them, if you give the task, you cannot imagine there's how brilliant they are. So if the platform is the same universally, it can be done, sir. And I don't believe an American student is smarter or the ruler of our in India is no, everybody the same human creation, sir. So just give a
Yes,
same platform, the technology can
yes,
deliver
sir.
it, sir.
So we have vernacular problem also, but we are Duolingo now is there, so we have a very big thing we can
Yes.
solve.
So there is a question in the chat. What is the logic of no practical exam for undergraduate?
Yes. So that's a good question. I asked the National Medical Boards, and because we observed it, since even I asked Jagan sir, he came in 1976 before ECFMG, and I showed the history. They found when you do the, say, for example, oral exam, what do we ask? Show anatomy, bone, a picture, tell me what it is. But now the technology show the picture, and you can do that way. So they said essay questions multiple are equal. They're not saying anything, but scalability, implementability, the corrections, the results coming, efficiency, expenses, all these to put together, they can achieve similar criterion based assessment eventually will not affect. Even if you ask students, even our faculty, the practical oral, it does not really change. And I think Dr. Venugopal sir here is the registrar of AP, he can comment on it. And the practicality of the even PG examination, the what we that's the reason they get away with enough evidence, sir. So it may be short, but remember, these are the people who created a CBME. These are the people who took 40 years who created the MCQs based, and they continuously researching. And there's no other body than NBME in the world does the research continuously. We can copy paste or something, but we need a platform like that. We can show them. Even our two individuals, Dr. Kakarla sir created a humanity, individual discrimination that Dr. Pemasani created and teaching the whole world. So we have the greatest minds, just need a little platform.
So it is not replacing the practical, but it is using technology to conduct that the same practical examination assessment.
They
Yes,
looked at it, sir. It's the labor wise, it's expensive wise. Even if
yes,
you talk to if you talk to any vice chancellor, it's so hard for them to bring the faculty to do this oral examination. At the end, how many people you're really failing? Oh, I just passed. They're not.
yes, I
You can,
understand.
yeah.
Yes, I think everyone understands that. Everyone can relate to this issue.
Yes.
But the computer will be very objective.
And one more question, sir. How could a pathology postgraduate and radiology postgraduate can write a essay and short question, multiple choice, and he can pass? They need to see thousands of pathology PG should take watch 200 pathology lectures, and that is assessment. Compared to that, how could an essay writing that? It doesn't. That's what the comparisons are. You can assess.
Yes, essay writing doesn't improve the cognitive skills. Maybe, yes.
Yeah.
So, Dr. Venugopal is asking, moving towards uniform global medical education. So he's thanking you for tireless efforts. Yogesh is asking, sir, can you explain criterion-based education in detail and why? Yes.
Okay. Dr. Venugopal sir unmuted. You want to ask questions, sir? Then I'll go to Yogesh first.
Yeah. Dr. Lokesh, can you hear me, sir?
Yes, sir. Go ahead.
Let me thank first Dr. Bedi, who is my batchmate in CMCL 5-mark fellowship, and Dr. Lokesh Idara, who is a good friend of mine. So this is really a good move. We are moving towards common global education. And as per the CBME, the current scenario is we have to involve students more in learning process rather than teacher is the centric. So my experience in our Maharaja Institute of Medical Sciences means, so we have introduced more interactive sessions and PBLs and also simulation center. We are having excellent simulation center. Right from the second phase, we have posted the students in the simulation center and we are training them. And already you have mentioned that location, there are flipped classroom also we have started. And one more thing we have introduced is role playing also we have introduced right from the first year. And ATCOM also we are using role playing this ATCOM and MCQs. Every week we are training our students in MCQs, multiple choice questions. And I think we are developing strong clinical skills and communication skills in the students. So our goal is like that to compete globally.
Thank you, sir. And criterion based, sir, for example, I'll give a clinical case scenario. One of my classmate, father is a doctor in a small town, had a motor vehicle accident, and he came chest pain. And the 5 or 6 things a basic MBBS doctor need to know, like I showed you, 1.6 kilometer run in 7 minutes. One is the chest pain, another is pneumothorax, of course, pneumonia, if there is a cough there. Those 5 things there, and he was seen a local MBBS doctor, and oh, is okay, just muscle pain and go. So he doesn't have the depth. Those 5 criteria need to be known. So that multiple choice question that when a pregnant woman or want to give a folate, if that's not more important than the curb cycle. The criterion basis is they keep a certain criteria you need to know. So those criteria is the one. For example, the military base, the example is simplified. Every subject, like pathology wise, you take what pathologies are common. What is in India? What is the common pathologies? Their faculty, their esteemed faculty will tell what an MBBS should expect and what they're able to recognize. And each specialty, like pediatrician, what is the when the kid is after 2 months, what is the milestones? Is it doing that or not? Like same thing, these are can be given this AppGo platform, which can be given, which is only $16 here. And that AppGo platform give 50 videos. You can go to the YouTube, and all of these subjects I made small videos in my YouTube channel. And so each small topic, they explained very well. For example, a 11-year-old girl not getting HPV vaccine, you go to cancer. In Scotland, you have 100% free of cancers because they don't have HPV. That point they know to know. These are the points which are not you pass it because you got a gold medal. It's just you need to know basic thing. I want the last kid in my college, MBBS in the rural area. Did they know all these things? That's all I need. I don't need a brilliant guy with knowing something anonymous. That does not serve my purpose. My family. I'm here talking today because a family in my town need to be taken good care. That's the reason of the assessment is not multiple choices. Assessment is enough to go and give a public health. That's why their mission, our mission too, we will do. So that's what the criterion basis, what I understand.
Yes. There is one more question. Can we somehow incorporate interpersonal skills in this model?
Absolutely. The best way to do in India, country like India, sir, not like just a manual lectures. You should create a module and like video based, say the same cases, and then the interpersonal skills can be either there is across the board what kind of things. That's what we can able to teach. Yes, interpersonal skills are very very important. Communication skill. What question I ask, for example, I will give one question. I'm an allergy doctor. I look at the nose, I see a nasal polyp. And then when I see a polyp, the patient's scared of it. And then I first say it is not a cancer. Polyp is not, nasal polyps never be cancer. So then there will be cancer. Then, so the psychology and communication is very key. What the words we use, very important. They will miss, there's a lot of chance of patients taking differently. It's very, very important. But how to deliver across India, we have to take the technology, and that's the only way to deliver.
Exactly. Yes, technology, because the number of, there are more than 1 lakh seats already. And in next 5-year plan, they plan to increase 10,000 more seats as per the budget announcement. So obviously we are going to need technology for such large volumes. There's no other way. And maybe I think MU India can also connect people and create such a question bank and maybe work in this direction under your guidance. So any questions, anybody?
One question I see here is, can the students joining, they don't have exposure to USA, UK based education. If they have an exposure like student exchange or seminars, they will know whom they are completing later. I think we are there. I think it's an excellent question. Thank you, Dr. Raghavendra sir. Um, um, I mean, 117,000 students coming to America and UK is not practical. But that's what we are trying to do. And we have already started an association, student associations to called Games, and we're communicating with them directly. But we can be with you. And one great thing NMC started is each specialty have their committee. I requested them, please add another one member or two from other countries. Parliament committee suggested NMC, please look at the best practices other countries. So, and also so we're trying to do, that's what my effort of connecting the ECFMG and BME to your high and your esteemed faculty of in India. And also there is association called Medical Regulatory Board Association, IAMRA. I think only Gujarat and Delhi, I think NBE members were asking IMA to be, so that they can, you can talk each other high faculty together, and then you can see what it is. That's what my job is. We made India to be in ILCO, ILC, or International Liaison Committee, 16 councils. That's the other thing they're talking about. AIMS people, all they're researching publication. So our job is bringing in the same platform, and they're asking us, the rest of the world asking India to take the lead, be part of it. So with any gaps we're trying to connect together.
Yes.
The other question, item writing question is another question. That's what I worried about MCQ. How in India, how I can get ATM? It's a God sent gift to the chat GPT. 70% were up there. If you any questions, sir, item writing is that's the other thing. You have to conduct item writing questions. That's what I request all pathology association, microbiology association, from anatomy to the medicine. Take this one, be challenged, and take each subject 2,000 questions. You have like thousands of faculty. Each one can do one college take one items, and then peer reviewed, and then put it on the website. It is free. And those questions, every college can take it, and they conduct tests. Even if the questions are open, 2,000, if my student read all the 2,000 questions, they learn, that's good enough.
Yes.
So that's the more burden, more request. My submission to all your societies, you can do it. It is so easy for you because you have so many of you small. Everybody is smart. You can do it, sir.
Yes. I think, thank you, sir, for the encouragement. And Dr. Venugopal has written something. Just a moment. Dr. Lokesh, what is the role of AI in assessment, especially in MCQ?
That's what I think the question also answered. AI, especially ChatGPT. Let me ask one of my resident came to my office and I told him, hey, Xolair is IgE mediated asthma treatment, biological. So go and do some questions. So he did the ChatGPT, Xolair, he unlearned it. Then I'm sitting with him. My nurse came and asked me, hey, doctor, we have patient with hives on steroids. Can I give a regular allergy shot? I thought about, okay, give it. So this student, ChatGPT asked, can be given to the allergy injection? Answer came as no. He asked me the question. Because of that, I can able to do higher order questionnaire. I said, if if you're on steroids, if you give a chicken pox or a live virus like yellow fever or smallpox, is deadly. So you cannot. If you give one injections a year with like influenza vaccine, yeah, you can wait until steroid done. By my allergy shots are weekly, year round, it doesn't make a big difference. So that question he raised because of Chat GPT, and that get me my 30 years experience to explain to him in 2 minutes, in 2 seconds. So that's what put it that the other esteemed speaker asked me how students are not able to answer questions. This is how they can do it and they can answer questions. You're going to come within the next 5 years. Faculty, be ready. They will be asked a lot of questions. In 2 seconds, they're going to ask you questions. Even high school kids are asking. Now, forget about a medical student. They will be asking you. So you better ready and accept it and learn from it. Within a year, you will answer all the questions.
Okay, there is another one. What is the scope of open book system and examinations? Dr.
Well,
Aditya.
this is what open book. We're not. That's what in America they're not really doing a closed book. They're putting you all the questions ahead. Let me explain. NBME, like our pathology or anatomy exam, they used to call shelf exam. Shelf means your cabinet you put your clothes. So they take you olden time. They take the books, the exam papers, put in a shelf. Old questions they gave to the fresh one to read about it, and then they build on it. So that's what it is. If the student read 10,000 questions, they're all open to it. They're already past it. So this is open book system. We're not closed. Actually, this is much more higher. If you create your own question, you are like a professor coming to the class. It's amazing. And actually the prompts, how to ask a prompt. I asked a question about the medicine, what is it, propofol and anesthesia, and then that give a side effect of it. Then I asked, can you give me case-based propofol? Then I give 60-year-old patient given this complication. You can ask, what is the complication, propofol, give me MCQ. It will be giving that. So you can ask different ways. It will get you different, and you will be bigger than a professor.
Okay. So
Yeah. Yes.
I think Doctor. So that's Dr. Kakinara, sir. Would you like to make a comment? Thank you for joining.
Dr. Jagan sir, can you unmute and make a comment?
I mean, we are honored to have you in this. In this webinar.
Yeah,
Yeah,
thank you,
now we're
Nima,
unmute, sir. Go
for
ahead.
being a part of this discussion. So the way we started and the way people are going, and especially Dr. Idra Lokesh, this is a progressive step, and we are trying to inculcate our knowledge into the world, and so that we move with the world. Thanks for coming together and trying to improve the education in India. So to compete with the other things, we have our own advantage, and as Lokesh mentioned, we have to move with the current standards, and so that we can compete with the same level as the other countries, and especially US. Thanks for letting me know. I want to congratulate Dr. Lokesh for his excellent work and dedication and commitment to do this kind of a thing. Thank you.
Thank you, sir. So I think we will. The next. What should be the next steps? After this lecture, I mean, creating a creating some questions.
Yes, sir. I think if the association of pathology example, if you can able to put together your members, give a task for each one, each chapter, bring the questions, and then present, and they will be accessible to your all faculty across the whole pathology in India, and they can able to do the questions, testing them, and that way our students can go and read before, or they can create themselves. So what videos you can, that's each topic, they can do so many across the world. Our faculty, I saw some of the videos are super. So anything much more than regular classroom, you cannot just one person. There's so much of knowledge goes on, and that's the first thing, sir. You were first one thing. If I ask your associations, both from anatomy to the all the ways, all 20, what are the question banks you want? What are the lectures you need to be peer reviewed? Each lecture they can present, you peer reviewed. Okay, they go on it. So you make 200 lectures, so they can go and watch that and then come back to them. That's one thing. MCQs, and also main thing is all of them has to write letters to NMC to immediately change the MCQs. Without that, this nothing will change. And it has to go to the 100%. Even 10th class, 12th class, CBSE have 60% MCQs. So if it's 20% now, at least they do 40, 60, 80. So they're waiting for academic council to give the advice to NMC to make that change. So that is the biggest block. Otherwise, that we cannot move. That's the first thing I would put policy-wise with the submit your faculty, write the letters. And of course, other things will come in place in no time.
Thank you, sir. So
And I
with
think we're
this,
going to see like Nalanda, we're going to bring it back to like Nalanda 1,000 years ago. We will be same as prestigious in the world. Thank you, sir. Yeah, go ahead, sir.
thank you, sir. Thank you. With this, we can end today's session, and we have it's exactly 1 hour. So
Thanks, sir.
thank you for the yes. Thank you. There are a lot of thanks messages coming on the chat. So thank you, sir. And with this, we can end.
Thank you, sir.